Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 39%. That's the projected growth in the demand for long-term care workers between 2022 and 2037, according to the Health Resources and Services Administration. Now for today's main story. Although concerns about hospital closures have dominated headlines in recent years, spending on construction of new hospitals and other healthcare facilities is moving at a record pace. Spending on hospital and clinic construction starts in 2026 was expected to jump 11.6% from the 2025 level and reach $30.7 billion, and that's according to Construct Connect, a commercial construction project data and software company. This year's spending surge would be the highest since the $33.9 billion spent on hospital and clinic construction starts back in 2024. That was a record in Construct Connect data that goes all the way back to 2009.
We have seen something amounting to a level shift up in recent hospital and clinic spending.
That was Michael Gukas, chief economist at Construct Connect. The 2026 increase in new hospital spending also was seen in an annual survey of 302 hospital executives by the American Society for Healthcare Engineering and Health Facilities Management magazine. 19% said their organization planned to construct a new acute care hospital within the next 3 years. And the spending on hospital and clinic construction starts was projected by Construct Connect to increase at a 7% compounded annual growth rate, or CAGR, to reach $38.8 billion by 2030. That projected increase was driven by factors like aging demographics and expected increases in government spending, and that increase was expected regardless of the nearly $1 trillion in reduced federal healthcare spending expected over the next 10 years under the One Big Beautiful Bill Act.
Any shortfall in public obligations, federal public obligations, we're not passing judgment on those yet. We assume that somehow a solution is identified, and so our forecast remains robust.
The number of new hospital and clinic construction starts each year have hovered around 200 facilities since 2017. Over the 7 years before 2017, they were higher and ranged between 300 and 400 facilities annually. And where are those new hospitals and clinics going up?
So last year, of the 236 projects, hospital and clinic new builds we saw last year, Texas was in the lead at 27 of those projects. Florida was second with 18 projects. California had 17, and Tennessee had 13. So those were your top four states, and of those, right, that was 75 projects. So about a third.
Spending on new construction for buildings like medical offices, outpatient surgery centers, and imaging centers were projected to increase by only about 5% CAGR over the next 5 years. In terms of total annual spending, that's an increase from $8.2 billion in 2025 to $10.5 billion by 2030.
The cost of new hospitals on a per square foot basis, it has been growing faster than your simpler, I would say, from a construction standpoint, your simpler medical office. There's a lot more complexities to a modern day hospital than there were in the past. And all those things raise the cost. And so to your point, the more expensive it is to build a hospital, right, the faster your dollar spend growth rate will be, even if the count of projects or total square footage built is at a much lower rate.
The leading non-hospital healthcare facilities and projects that ASH survey respondents said were under construction in 2025 were ambulatory facilities which 13% of respondents said they were building. Also, 11% were engaged in central energy plant construction, 9% were constructing physical plant infrastructure upgrades, and 8% were constructing medical office buildings. The facilities that have experienced the most growth recently were micro hospitals, which 6% were building, and freestanding emergency departments, which another 6% were also building. In previous surveys, less than 1% of organizations typically said they were planning to build such facilities. So, despite headwinds from policy and secular trends, it looks like it's building season for the healthcare sector. Now, before we go, just one more thing. After years of allegations by payers that the increasing hospital adoption of AI-driven billing is surging costs, the industry has produced the first research that allegedly quantifies it. Hospitals' AI-enabled coding capabilities drove a $2.3 billion increase in spending in a recent 3-year period. That's according to new research from Blue Health Intelligence, a data analytics partner of the Blue Cross and Blue Shield Association. The estimates stemmed from a Q2 2022 to a Q1 2025 analysis of commercial claims data for hospitals paid through a Blue Cross member plan. But Sean Stack, a director of perspectives and analysis at HFMA, said the study appears to conflate improved documentation accuracy with so-called aggressive coding. Over the past decade, hospitals have made substantial investments in clinical documentation improvement programs that ensure medical records accurately reflect patient conditions and severity of illness. And many AI-supported tools used by hospitals assist clinicians in identifying conditions already present in the medical record, but historically underdocumented or inconsistently coded. Stack said that capturing these diagnoses more accurately does not necessarily represent upcoding. In many cases, it reflects better clinical documentation and data integrity, which is a very important element in value-based payment and clinical outcome analysis. Well, that's all we've got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.